Greetings! We will present final projects. When you are sick, what do you do? Googling and find out what happened to you like that. Maybe you have the cancer cell on your body if you are Google. So we will guideline on you how to find out or treatment for common illness. But before we begin, let us introduce ourselves first.
Causes. The most common causes of diarrhea, for example, bacteria from contaminated food or water, virus such as the flu, norovirus, or rotavirus. Rotavirus is the most common cause of acute diarrhea in children. Parasites, which are tiny organisms found in the contaminated food or water. Medicines, such as antibiotics, cancer drugs, and antacids that contain magnesium.
Diarrhea is loose watery stool. You have diarrhea if you have loose stool 3 or more times in one day. Acute diarrhea is diarrhea that lasts a short time. It is a common problem. It usually lasts about 1 or 2 days, but it may last longer. Then it go away on disorder. Diarrhea lasting more than a few days may be a sign of serious problem, chronic diarrhea. Diarrhea that lasts at least 4 weeks can be a symptom of chronic disease. Chronic diarrhea symptoms may be continued or they may come and go.
The drug used to treat diarrhea is loperamide. Loperamide slows the movement of food through in your intestine, which let your body absorb more liquid. 6 tablets or capsule in 24 hours if you bought them from a shop. 8 capsule or tablet or 16 spoonful of liquid in 24 hours if you bought them from a pharmacy. Do not take loperamide more than 48 hours without talking to a doctor.
We will present information about itching rash. Cause of itchy skin include skin condition. Example include dry skin, psoriasis, parasites, insect bites and hives, irritation and allergic reactions, chemicals, salt, and other substances can irritate the skin, cause rashes and itching. Also, reaction to certain drugs, such as narcotic pain medications, can cause itchy skin.
Symptoms. Itchy skin can affect small areas, such as the scalp and arms or leg or the whole body. Itchy skin can occur without any other noticeable changes on the skin, or it may be associated with redness, scratch marks, and spots or blisters dry. Sometimes itchiness lasts a long time can be intense. As you rub or scratch the area, it gets itchier.
Itchy skin treatment focus on removing the cause of the itch. Use of calamine. Use this medication on the skin only. 1. Shake the calamine lotion well just before it is used. 2. Apply calamine topical directly to the skin and rub in gently. You may also use a cotton ball to smooth the medicine onto your skin.
We will present information about fevers such as causes, symptoms, and treatment. Fevers occurs when an area in your brain called the hypothalamus, also known as your body thermostat, shifts the set point of your normal body temperature upward. The fever is caused by a virus infection. There are many different types of flu-causing viruses, but the most common is the rhinoviruses. Rhinoviruses can enter the body through the mouth, eyes, nose, and can also spread through the air. Symptoms: you have a fever when your temperature rises above the normal range. What's normal for you may be a little higher or lower than the average normal temperature of 98.6 Fahrenheit or 37 Celsius. Depending on what causing your fever, additional fever signs and symptoms may include sweating, chills, and shivering, headache, muscle ache, loss of appetite, irritability, dehydration, general weakness.
Treatment of my fever is part of the immune system response to bacteria, virus, and other pathogens. It helps the body fight off infection. However, it can be uncontrollable, and a fever can sometimes lead to complications. For this reason, doctor may sometimes recommend medication called antipyretics to lower a person's temperature. Example includes as ibuprofen, acetaminophen. Can also reduce a fever. If a person is sweating a lot, they may experience dehydration. In this case, they should consume plenty of fluid to prevent complications.
Causes of stomach disease include 1. Helicobacter pylori infections, which is the most common reason. 2. Taking plant delivered that by the stomach. 3. Taking antiplatelet drugs. 4. Drink alcoholic beverages. 5. Strain. 6. Eating spicy food. 7. Not eating food on time.
Stomach disease symptom. First, abdominal pain, stomach position under the epigastric. Second, bloating, indigestion, frequent burping, tiredness, and uncomfortable stomach despite not eating anything or eating little. Third, anorexia and may become thin.
Then treatment, use of Untitled Chapter for symptomatic relief of upset stomach associated with hyperacidity, and hyperacidity associated with peptic ulcer and gastric. Orally administration 1 to 2 tablets thoroughly, and then several with water. 3 to 4 times daily, 1 to 2 hours after meals, and at bedtime, or as prescribed by the physician.
So let me introduce myself first. I'm Phil, a first-year pharmacy student, and I'm really pleased to meet you.
Okay, I'm Varanchai Bongwarasi Road. I'm pharmacist here, Green Tea Store.
So I have some questions I would like to ask you. What are the correct methods for taking the medicine?
The correct method to take the medicine is easily you can read the method or the way to take after meal or before meal, inside or back of the package of medication. It tells you all things about to take. You can take 1 pill or 2 pills or before and after 3 times a day or twice. It's prescribed you all this after on the label.
Thanks for clarifying that out. And so, what do the patient need to know before seeing a pharmacist? Or how do a pharmacist help the patient if he or she doesn't know what illness they are dealing with?
Okay, this question separates 2 questions. First, what the patient needs to know about him or herself before seeing the pharmacist, right? First thing, they need to know who is very patient, who is the real patient, just him or other. If the patient is other people, then they need to ask questions about his information, such as drug allergies, underlying disease, or the medication that he take before go to the pharmacy.
So we need to avoid the allergy. So as we know, the drug allergy are unpredictable symptoms. If it happens, what do you advise the patient to do?
Sure, yes, drug allergies, we don't know what happened and when they happen. So if you take any medicine, any medication can cause a drug allergy. So if you have to take it, you should observe yourself after taking medicine, and as long as the medicine has inside the body. When the medicine can eliminate all of medicine out of the body, we don't know. But you can ask the healthcare provider or pharmacy what the medication, or when the medication can clear out of your body.
So we need to ask the pharmacist about that.
Yes, and the most important is observe yourself. What happened to you? What the side effect or the allergy that can happen, such as fever and rash or difficult to breathe, is all side effect and allergy.
That is really helpful. So lastly, what are the household remedies we need to have?
Household remedy. Okay, the household remedy in Thailand, medication separate to three parts. First one is over-the-counter medicine or OTC, and second one is dangerous medicine, and the last one is controlled medicine. So if you the medication that I want to introduce to have some at home is the OTC, because it can easy to access and very useful, and it's quite safe for use when you have any symptom, such as paracetamol for anti-fever and antihistamine for allergy, and some painkiller for some accident. But OTC is still medication, so this can cause side effect and interaction from food, drugs, and disease. So if you have this, if you use this medication, if you done better in 2 or 3 days, you should see a doctor or come to consult with other healthcare providers.
So thank you so much. That would be so useful for us and for people who watch this video too. So thank you for taking your time to talk to us. I really appreciate it. Thank you.
Thank you.
Yeah, in the summary, when we talk with the pharmacist at the drugstore, the first one is the correct method to take medicine, and the answer to follow the dose level. Next, what does the patient needs to know if he or she are going to see the pharmacist?
The patient needs to know what medicine they are allergic to and need to tell a pharmacist about that as well.
If drug allergy happens, what should the patient do? There are many signs of drug allergy, like pharmacist says. If it happens, you seek a pharmacist.
If you are in a very severe condition, we advise you to go to the hospital. Last but not least, if the medicine the pharmacist will suggest we should have as household remedy. He suggests us the OTC medicine, which is also called non-prescription medicine. You can buy freely pharmacy such as paracetamol, antihistamine, painkiller, and first aid kit. And that is for summary.
Now that everyone has received interesting information about symptoms, causes, and treatments, as well as further knowledge from the pharmacist, I hope that everyone will be able to apply this information in their daily life, such as purchasing the appropriate medication for their illness list. And finally, may everyone be healthy. Always wear a mask and strictly follow the instructions from the pharmacist.